Diabetes affects millions globally, especially in India, across all age groups. Traditional treatments manage symptoms, but what if we could address the root cause? Enter stem cell therapy, a groundbreaking approach in regenerative medicine that holds potential to repair or replace the insulin-producing beta cells in the pancreas. For type 1 diabetes, early clinical trials show that stem cell transplants may help increase insulin production and reduce reliance on injections. For type 2 diabetes, the therapy aims to reverse insulin resistance and improve blood sugar control, but results vary by individual. In India, global stem cell care is helping bridge the gap between patients and expert-led stem cell treatments, focusing on customized care, expert consultations, and long-term support. While stem cell therapy isn't yet a guaranteed cure, it offers hope, and with continued research and proper lifestyle support, it may transform how we treat diabetes in the near future.